Hello, my name is David DeMarco, and I'm a Medicare counselor in New York State for the Saratoga County Department of Aging and Youth. The department provides free Medicare counseling services for the residents of Saratoga County. Those counseling sessions are provided either by department staff or volunteers such as me. Our only objective is to help you find a Medicare plan that is best suited for you out of all the available plans in our area. We do not favor any particular companies or types of plans. During this video, we will review the major parts of Medicare, the different ways in which you can get your Medicare coverage, why people tend to choose certain types of plans over other types of plans, and 3 programs that will help some people pay a portion of their Medicare costs. So let's get started.
What is Medicare? Medicare is health insurance for 3 groups of people. People who are 65 and older, people who are under 65 with certain disabilities, and anyone with end-stage renal disease. Let's review certain terms we'll be using during this video. A premium is a dollar amount you must pay periodically, usually monthly, but it could be quarterly or yearly, to participate in Medicare or an insurance plan. A deductible is an amount of expense you must pay before a Medicare or your insurance plan will help you pay for the rest of the year. When you use a particular service, you will pay for that service either as co-insurance, which is expressed as a percentage, for instance 20%, or a co-payment, which is a set dollar amount, for instance $50. To keep this presentation simple, I may often use the word copay to refer to both co-insurance and co-payment. This chart provides an overview of Medicare. Please note, during this presentation, we will not be discussing coverage through the Veterans Administration or retiree coverage you might have from a former employer. When we talk to our clients, we generally describe there are 3 major ways that they can get their Medicare coverage. They can have just original Medicare, which includes Part A for admitted hospital stays, Part B for many other medical services, and prescription drug coverage, which is referred to as Part D. Many people choose to add a Medigap plan to original Medicare. A Medigap plan helps you pay your copays and deductibles you would be responsible for under Part A and Part B. A third option is to enroll in a Medicare Advantage plan sold by a private company. Medicare Advantage plans usually also include prescription drug coverage. We'll talk about all of these major options in much more detail on the remaining slides. As I just mentioned, one option is just to enroll in original Medicare, which consists of Part A for admitted hospital stays and some other items which we'll review on the next slide, Part B for many medical services such as doctor's office visits and outpatient procedures, and drug coverage, which is referred to as Part D. So let's review some more details. In addition to covering admitted hospital stays, Part A also covers care in skilled nursing facilities, home health services if intermittent skilled nursing care is required, hospice care, and the cost of blood during your hospital admission.
Most people do not pay a premium for Part A. However, if you are admitted to the hospital, a benefit period begins. If that benefit period lasts up to 60 days, that's considered one benefit period, even if you're in the hospital multiple times and for different conditions within that 60 days. For that one benefit period, you'll be responsible to pay a $1,676 deductible. If your benefit period lasts more than 60 days, you'll start paying an amount per day.
Part B covers many medical services not covered under Part A. For instance, doctor services, outpatient medical and surgical services, durable medical equipment such as oxygen and wheelchairs, certain home health care services for medically necessary skilled care, and many other services are covered under Part B.
Most people pay a monthly premium of $185 for Part B in 2025. Certain low-income people might not pay that premium, and some higher-income people might pay more. Everyone with just original Medicare Part B is responsible for a yearly deductible of $257. Once you met that deductible by your copays on Part B services, for the remainder of the year, Medicare will pay 80% of your Part B costs, and you'll be responsible for 20% of those costs. It is that 20% responsibility that causes most people to look for additional insurance, either by buying a Medigap plan or by enrolling in a Medicare Advantage plan.
Part B covers many preventive services, as you can see on this list. Some of the services are free to everyone, while other services are free only if you are at risk for certain conditions. The next few slides discuss enrolling in Parts A and B. At age 65, if you are already receiving your Social Security benefits or Railroad Retirement Board benefits, you will automatically be enrolled in both Parts A and B. 3 months before you turn 65, you will receive an initial enrollment package. Also, people who have been on Social Security disability for 24 months will automatically be enrolled in Parts A and B. Everyone else must enroll themselves. So, if you are not receiving your Social Security benefits, or you chose to delay enrollment when you turn 65 due to current employment, you must enroll. You enroll for both Parts A and B through Social Security, either online at their website, by calling Social Security, or by visiting one of their offices. You can apply 3 months before you turn 65, and you don't have to be retired. Individuals can elect to enroll in premium pre-Part A at any time of the year.
When will your Part B coverage start? If you enroll in the 3 months before you turn 65, your coverage will start on the first of the month that you turn 65. If you enroll in the month you turn 65 or the following 3 months, your coverage will start the month after you enrolled. If you did not enroll during the initial enrollment period, you can also enroll during the general enrollment period, which is January 1 through March 31 of every year, and your coverage will be effective the month after you enrolled.
A person can delay enrollment in Part B when they turn 65 if they or their spouse has coverage through active employment. Once that employment ends, you have 8 months to enroll in Part B. COBRA and retiree coverage do not delay the 8-month window to enroll. Also, people should not delay enrollment if they work for an employer with fewer than 20 employees, since that insurance coverage typically expects you to have both Parts A and B. There is a late enrollment penalty for any person who could have enrolled in Part B but didn't sign up for it. The penalty is a permanent increase to your Part B premium. Parts A and B of Original Medicare do not cover many items such as long-term care, routine dental care, routine vision, dentures, cosmetic surgery, and hearing aids. You can find other items not covered at www.medicare.gov. Since these items are not covered by Original Medicare, they will also not be covered by Medigap plans, which we'll be discussing shortly. However, certain Medicare Advantage plans are being allowed to offer additional benefits. Let's briefly review prescription drug plans under Medicare. They're also referred to as Part D. Prescription drug plans are approved by Medicare but operated by private companies and are available to everyone with Medicare. You must be enrolled in a plan to get prescription drug coverage. There are 2 ways you can get this coverage, either through standalone Medicare prescription drug plans, often referred to as PDPs, or actually through a Medicare Advantage plan. You will find that costs for prescription drug plans vary by company and plan. Most people will pay a monthly premium just to be a member of the plan, a yearly deductible, which is typically just applied to more expensive prescription drugs, and co-payments for your drugs when you actually get a prescription refilled. If you have a gap of more than 63 days in your drug coverage, you could incur a penalty, which is a permanent increase to your monthly drug premium. We've now covered Original Medicare. And as I mentioned earlier, many people want additional coverage beyond that provided by Parts A and B. One way of getting that additional coverage is by enrolling in a Medigap plan, or what's also referred to as supplemental insurance. Medigap plans work with Parts A and B.
Medigap plans can pay your Part A and Part B copays and deductibles. They do not cover your premiums for Part A and Part B, and also do not cover any prescription drug costs. Companies can only sell standardized Medigap policies. You'll see them identified by letters A through N. With a Medigap plan, you can visit any doctor or facility that accepts Medicare. And finally, people who turn 65 after 2019 cannot purchase a Medigap plan that covers the Part B deductible. We'll see more about that in a couple of slides.
Monthly premiums for Medigap plans can vary significantly by company and plan. The New York State Department of Financial Services maintains a website with the current pricing on all Medigap plans in New York State. Please check out this website. Also, in New York State, it is important to know that you can enroll in or change your Medigap plan at any time of the year. The first step in choosing a Medigap plan is to consider the amount of coverage that you want. This somewhat complicated chart displays your options. Listed under benefits in the first column are all of the Part A and Part B costs you might be responsible to pay. The columns, represented by letters A through N, are the various types of plans you can purchase. For instance, if we look down column G, we can see that that plan covers all of the Part A and Part B costs at 100% except for the Part B deductible. Since this is a somewhat complicated decision, we usually begin with our clients by comparing just plans G and N. Neither plan covers the Part B deductible. Plan N also does not cover the Part B excess charge. An excess charge is an amount a doctor might charge you above the Medicare allowance, but New York State severely limits excess charges. Plan N covers the 20% for Part B coinsurance, except you'll notice the note on the bottom of the page that you might be responsible to pay $20 for doctor office visits and $50 for an emergency room visit.
Once you've decided on the type of Medigap plan that you want, we suggest you purchase that plan from the company with the lowest monthly premium. This chart displays the monthly Medigap premiums for Saratoga County from the New York State Department of Financial Services website. Please check this website as prices can change throughout the year. On the website, you'll see the actual company names in the first column. Let's look down the Plan G column once again. You'll see that Company B offers Plan G for $655.48, whereas Company I offers exactly the same plan for exactly the same coverage for $257.38. Again, as we did on the previous slide, let's look at column G versus column N. You'll see that column N pricing is lower without having to incur significantly more costs, as we saw on the previous slide.
Let's review the third option for getting your Medicare coverage, which is enrolling in a Medicare Advantage plan. Please note, when you enroll in a Medicare Advantage plan, you still need to enroll in Parts A and B and will still pay the Part B premium. Medicare Advantage plans typically provide all of your health care coverage. They are still part of the Medicare program, but offered by private companies. And as I mentioned, you must still pay the Part B monthly premium. They are also referred to as Part C. Some plans require you to use their network of participating doctors and hospitals. Other plans allow you to go outside the network to non-participating doctors, but that is usually more expensive. With Medicare Advantage plans, you still receive Part A and Part B services, but the actual benefits and costs may be different than original Medicare. There are many plans with very low or actually no monthly premiums. You'll have to pay a copay for most services, but most plans also include your prescription drug coverage. It is important to note that all Medicare Advantage plans must cover valid emergency room treatment anywhere in the country. Also, many Medicare Advantage plans now offer extra benefits such as vision, dental, hearing, and transportation services. We have now covered the three major ways in which you can get your Medicare coverage. You can enroll in Original Medicare, which includes Part A and Part B, and add a prescription drug program. You can supplement your Part A and Part B coverage by buying a Medigap plans, which will help to pay the copays and deductibles for Part A and Part B, or you can choose to enroll in a Medicare Advantage plan. We are often asked, which type of plan is better for me? The simple answer is, neither a Medigap plan or a Medicare Advantage plan is better for everyone. It depends on your health, your lifestyle, and your financial situation. This chart summarizes certain key features of the plans based on discussions with our clients. Medigap plans have higher monthly premiums, but small or no copays for services, whereas Medicare Advantage plans have lower or no monthly premiums, but you will pay a copay for most services. Often, individuals requiring expensive or many medical services will choose a Medigap plan, whereas individuals requiring fewer services may choose Medicare Advantage plans. With a Medigap plan, you can visit any doctor or facility in the country who accepts Medicare. With Medicare Advantage plans, you usually visit the participating doctors or facilities, and some plans will allow you to go out of their network. Finally, with Medigap plans, you must buy a separate prescription drug plan. However, Medicare Advantage plans usually include prescription drug coverage.
At least once a year, you can entirely change your Medicare coverage during the open enrollment period. You can request changes from October 15th through December 7th, and those changes will be effective January 1st of the next year. The Department of Aging and Youth offers free individual counseling sessions all year long, and we also do phone counseling. To take advantage of these counseling services, please call the department at 518-884-4100.
People with Medicare Advantage plans can make changes to those plans from January through March of each year. They can change from one Medicare Advantage plan to a different Medicare Advantage plan or to Original Medicare. They are allowed one change during this period of time, which will be effective the first of the following month.
Let's briefly discuss three programs that can help some people pay their Medicare costs. In 2025, Medicare savings programs pay the Part B premium for single people with monthly gross incomes of less than $2,446. If you are single with a monthly income of less than $1,820, these programs may also pay your Part A and Part B copays and deductibles. Married individuals have higher income levels based on their joint income. You apply for these programs at the Saratoga County Department of Social Services. If you receive a Medicare savings program, you also receive extra help, which we'll discuss on the next slide. And in New York State, there's no limit on your savings or other assets. Extra Help is a federal program that can help pay prescription drug costs. It pays a portion or all of your monthly drug premium, and you'll have lower prescription drug copays and no deductible. You can apply directly at Social Security, but if you do, your monthly income must be less than $1,956 for a single person or $2,644 for a married person. And Social Security applies a limit on savings and assets in this program. However, if you receive a Medicare savings program that we discussed on the previous slide, you'll automatically receive extra help.
We encourage everyone who is eligible to enroll in the New York State EPIC program. It can lower your prescription drug copays. You'll have more flexibility in changing your Part D drug plans, and for lower income people, it can help also pay your Part D drug premium. To be eligible, you must be 65 or older, a New York State resident, and be enrolled in a Part D drug plan, either a standalone plan or a Medicare Advantage plan. You are eligible if your annual income is less than $75,000 for a single person or $100,000 for a married person. EPIC is split into two plans depending on your income. The fee plan is for single individuals with an income below $20,000 or $26,000 and married. They pay a small quarterly fee, but their lower EPIC copayments apply throughout the entire year. The deductible plan is for individuals with incomes above those levels. They must first meet an EPIC deductible, which means they must pay a certain amount every year on their drug copays before EPIC will help them pay those copays for the rest of the year. However, there is no cost to being a deductible plan member. For single people with incomes below $23,000 or $29,000 and married, EPIC can also help pay your monthly drug premium. Finally, all EPIC members can change their drug plans once per year at any time. At the Medicare.gov website, you can review Medicare plans available in our area and compare those plans side by side, especially Part D drug plans and Medicare Advantage plans. You are able to create an account and save your list of prescription drugs, which makes it easier to compare plans when it's necessary. This is the actual website we use in our counseling sessions.
Thank you for watching our video today. We hope that it helped you better understand Medicare. If you have any questions, need additional information, or would like to schedule one of our counseling sessions, please call the Department of Aging and Youth at 518-884-4100. Thank you and have a great day.